I'm going to talk about OHCEA's approach to capacity development and also the lessons we've learned in the past 10 years of the network's existence. This is my overview of my presentation. I'll talk about lessons learned in network formation, network strengthening, and capacity building. So OHCEA is an international university network. We are currently in 8 countries on the African continent. I will not go into details because we've heard about this since yesterday. We are in those 8 countries. We're in 16 universities in those schools. Our vision is to be a global leader and champion in One Health. And also, we do this through training, through research, and then resource mobilization and partnerships, and then organizational and network strengthening. I know the previous speaker, and in the morning session, breakaway panel in this room, you had a clear definition of what a One Health workforce is. So we follow that definition in implementing our strategies. And this is our implementation strategic framework. We engage government in defining capacity gaps of the network, of the workforce in service. And then we design programs that speak to some of those gaps. So institutional strengthening is one of our strategies. And we do this through changing the classroom environment, through revising curricula, and also through faculty development, because we realize that faculty cannot train what they don't have. You cannot give what you don't have, so we first have to build the capacity of faculty to train in a multi-sectoral manner, and also before they can pass that on to the students. So we have different training programs at in-service level, at pre-service level. We've also offered different scholarships to different institutions depending on their work plans, and a number of innovative degree programs. We have One Health problem-based learning case studies, and also in this conference we are pitching a student case competition. You'll have an opportunity to see how this works. You'll see our students, how they compete. And also, we hope that this improves the systems. Lessons learned. The network started in 2009, but before that, the teams that formulated this network had already worked together under different umbrella. So they evolved in 2009 into OHCEA, and they had a core group of visionaries that led this movement. And of course, it has been a process of learning. The network has gone through a formative stage, and now we're at a level where we can say that we are takeoff stage. And I'll talk about that in my lessons learned. So for network formation, first of all, you need visionary leadership. That is critical. And you've seen these 3 gentlemen at this conference. Yesterday, they were the stars of the opening ceremony. So these 3 gentlemen are the brains behind the network. They've showed the network the way to vision realization. We also have institutions that are allowed to test this vision in their institutions. Academic institutions are normally bureaucratic and well-structured, but we came in with an innovation that was going to interrupt their normal programs, and a number of all those 16 universities you saw allowed for us to test that. So you need that core group of visionary leaders. And also you need resources. Resources are critical to forming a One Health network, especially because you're going to break silos and operate outside the normal principles that you've been operating in. So you need resources to do that. And of course, you need management. You need a team of champions who believe in the vision to oversee this. And of course, you need a loyal development partner. And for us, we've been lucky with USAID. USAID has stood with us for the past 10 years to allow us test the vision that we have. You also need to have, and I know Jeff summarized this in his presentation, but now we are giving examples of how this has worked. Network structures are critical. We have a board. We have a board of directors. a board of directors. We have a leadership summit. You saw our deans here yesterday were recognized at the opening. They constitute a leadership summit. We have a regional secretariat where I sit. And then we have country secretariats. And we have the government. We work with the 8 governments where we are located. And of course, network partnerships and relationship building is critical. And I know that was one of the points Jeff talked about. You need to engage key stakeholders if you're to build a One Health network. We also learned lessons on how to strengthen this network. So growing the network, stakeholder engagement is critical. It's a lesson we've learned. Diversification of membership over time, and yesterday from the keynote we had, we realized that even the members we have, we need more members. We need more disciplines on board, given what is at stake. We've learned that for you to strengthen a network, you need to build the capacity of especially the team, the staff. Our capacity at the Secretariat has to be strengthened in terms of financial management, in terms of giving technical support, in terms of coordination and networking, engaging stakeholders, also setting up coordination sub-offices. You need to take the services closer to the people. So without proper coordination, the network is in 8 countries and scattered as you saw. So we needed to have sub-offices at country level to ease coordination. And also, we learned that you need to strengthen governance structures. You need to retool, to expose even the board. You need to expose the governance leaders. So it's one of the strategies for network strengthening. Still on this, we're at a stage where we are winning off our North partners, in the sense that we are now having less support from the North. I know Professor Ngore asked about having more faculty exchange. This is something that we are adopting slowly. Currently, we are doing a lot of South-to-South collaboration. We move faculty from Uganda to go and strengthen Rwanda activities and vice versa. Before, we used to have a lot of US partners coming in to train, but now we are using the faculty, the capacity that we've already built at national level. So we are doing that. And then generating evidence is critical to strengthening the network. Before you institutionalize, somebody has to be sure that this really works. So we've generated evidence over the years, and we are working at institutionalization. Knowledge management is an area that it's work in progress. We are learning a lot from what we are doing and harvesting products and packaging them, standardizing them, so a number of institutions will be able to use them. Of course, visionary leadership is critical in strengthening the network, and also network management. Resource mobilization is critical, and allocation. Continuous communication and stakeholder engagement is also critical. Lessons learned, we've learned a lot. We're a capacity building institution. I don't know whether wherever the 10 minutes stop, I'll stop. So we've learned a lot in capacity building under those 4 areas: engaging government in workforce planning, in pre-service training, and it's supposed to be in-service and pre-service and faculty development. So I'll walk you through one by one. We are in a process of what we call workforce development, and we start with assessments, and then we plan, and then we develop the workforce. We train. We develop training programs that speak and address those gaps, capacity gaps. So under this, we've learned a lot. We've learned that, first of all, the capacity gaps are similar across the regions, at least across the 8 countries that we are working in. So this makes it easier and allows for regional approaches in capacity building, although there's need for you to contextualize these regional approaches, but that has helped our network a lot in coming up with regional approaches that can be contextualized at country level. We've also learned that in engaging government, universities, working with the universities, we need to train our faculty to engage government. It's not obvious for us in academia to engage government, be familiar with government policies and how government works. So in many cases, you find how you engage government in Rwanda is different from Uganda, and it's different from Senegal. So this is something that we equip our faculty with, because government engagement is critical to capacity building that is relevant and strategic for national development. And we need to anchor our One Health frameworks within the government ministries, especially in government entities that have the mandate to convene different sectors. I can't check there. I'll move on to pre-service. In pre-service, we've learned a lot. We realize that investing in pre-service is really key because it is at that level that you're having the formative stages of career development. So you can shape the students to become multi-sectoral and multidisciplinary thinkers at pre-service level before they get out into in-service. It's cost-effective. There are many disciplines that you can access at institutional level. You're finding all the disciplines almost on one campus. So it's so easy for you to group these students under multi-sectoral teams. So that is a lesson learned. And also there's need to diversify One Health training to pre-university workforce. I know we've piloted this in Tanzania, and it has worked well. And right now, the government of Tanzania is institutionalizing this. There's also need for private. There's need for engaging the private sector and the public in academia. This is to leverage on the infrastructure and also mentorship. And we've learned that One Health in practice, is necessary. The practical aspects have to come at a training level. So we use the One Health demo sites. We have also the student innovation clubs that are student-driven. These have been very effective platforms in building the One Health workforce. And for in-service, it's important that we address the capacity gaps, and it's even better if it is government-driven. So that is why it's important that there is continuous government engagement. We have a number of opportunities for CPDs. We have CPD programs in One Health in Rwanda and in Tanzania, and I know Uganda is in the process of developing one. Faculty development is critical. We need to change and transform the mind. It's not easy for a professor to start thinking differently from the way they were trained. So there is need to build capacity of faculty for multi-sectoral collaboration, and also in service learning as a platform. Thank you so much.